Can uneven hips or an unbalanced pelvis be related to your scoliosis? One of the things that's very noticeable in a diagnosis of scoliosis, especially in certain types of scoliosis, is going to be pelvic alignment. And uneven hips or unlevel hips is one of the things that could be associated with a scoliosis. So if you notice that you have an uneven pelvis, or even a pelvis that looks rotated, one side more forward, one side more backwards, that could be related to a scoliosis. And if you have that, you want to have your spine evaluated. However, if you have scoliosis and you have a rotated or unlevel pelvis, it can be helped to help reduce the discrepancy of what you're seeing in the pelvis, to help improve the cosmetic impairments and the structural impairments and stability of what we're seeing. So when it comes to scoliosis, we know there's multiple severities of scoliosis. Classically, there are 3 categories: something called mild scoliosis, which is between 10 and 25 degrees, moderate scoliosis between 25 and 40 degrees, and severe is 40 to 45 degrees and greater. I also use a 4th category, which is something called very severe scoliosis, which is like 80 degrees or greater, because we know that's when there are more likely to be some more visceral or functional effects as a result of the scoliosis. When it comes to looking at visual symptoms of scoliosis, outside of just seeing uneven hips or uneven pelvis, what else can you see? Well, you can see uneven shoulders. You can see shoulders that one side looks more forward, one side looks more backwards. You can see ribs that don't look symmetrical. Rib humping or rib deformity is the most common thing of seeing in the scoliosis. You can see something that we call leg length differences. It's LLD, leg length discrepancy or differences. One side looks lower or higher than the other side. And then obviously a very crooked spine. When the person bends forward, looks from the back, you can see there's actually a curvature in the spine. So these visual symptoms can be corrected, but they can only be improved or reduced if the scoliosis itself is reduced. Meaning that if you're just treating the symptoms of scoliosis, that means if you're experiencing pain and you're getting treatment for pain and you don't reduce the size of the scoliosis itself, you're normally not going to see these visual things tend to improve. In a conservative approach, we use multiple modalities and therapies and treatments to help elongate and reduce the curve. We also use something like corrective bracing to help reduce rib deformities and balance pelvises to help get the very best reduction in terms of what you're seeing. So not only do we get structural improvements in what we're seeing in the spine, we want to get cosmetic improvements in what we're seeing in a person's posture and body, meaning leveling out shoulders, ribs, and pelvis. If there truly is a leg length difference or discrepancy, that has to be properly evaluated, and normally it's lifted with either a shoe lift or a heel lift or something built on the bottom of the shoe to help balance out the pelvis, because if there's truly a leg length discrepancy, that can't be corrected just by treating the spine and pelvis, because it's something in the actual length of the legs, which can happen. Another way that you can see pelvic differences is something called rotation. Pelvic rotation or pelvic twisting happens within the pelvis itself. It can be one of 2 things. It can be truly just a pelvic rotated in space relative to the rest of the spine, and it can truly be like a pelvic deformity, meaning the pelvis, when it fused together as a child, fused in a rotated version because of the scoliosis. So there's truly a deformity within the pelvis. If there's a deformity of the pelvis, obviously that can't be corrected. We just manage it with leg length, with either a leg lift or bracing and therapy to help balance it as best as we can in space. If there's pelvic rotation in space, that's not a true deformity, that can be reduced with therapy and exercises and chiropractic and bracing. So most of the things that we see, we can improve at some level, meaning with conservative treatment approaches to help manage what you see visually as a result of scoliosis. So if you're concerned about some of the things that you're seeing in your scoliosis, meaning ribs, shoulders, and pelvic alignment, we definitely recommend that you reach out to us here at Scoliosis Reduction Center, and don't let things progress, because the further they progress, the worse you're going to see visually when it comes to your scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.